Hi, this is Rosie. She's waiting to go for her surgery in the hospital. She is already dressed in her hospital gown and hat. Look, Rosie brought her favorite teddy. I'm Keegan, and I'm your guide. We're here to show to you what it's like to go for surgery. When it is time for her surgery, Rosie says, "See you later," to her parents, and rides on a bed with wheels through the hallway to the operating room. Moms and dads can't go into the operating room with their kids, but Rosie won't be alone. The nurses there are very nice, and they will take good care of her. Kids even get to bring their stuffed animal with them. The nurses greet Rosie in the hallway outside the operating room. They ask her some questions like her name and birthday, and have a look at the bracelet on her wrist. Then they take Rosie into the operating room. In the operating room, there are nurses and doctors wearing funny hats and masks. They have to wear these things so no germs get brought into the operating room. The nurses help Rosie get onto a bed in the middle of the room, and then they get a nice warm blanket to wrap her up in. Her head goes on a special pillow called a donut. The nurses put some stickers on her chest and put a clip on her finger. The stickers will help the doctor see how her heart is beating, and the finger clip will show how well she is breathing. They also wrap a Velcro on her arm. This cuff will give her arm a big hug and a squeeze to measure her blood pressure. There are also some strange machines in the operating room. One of the machines is for the anesthesiologist to use to make sure Rosie is asleep for her surgery. The anesthesiologist has a bunch of special smells such as raspberry, cotton candy, and grape. Rosie gets to choose the one she wants to try. Then the doctor puts a smell in a special mask. Look, Rosie's teddy gets to try too. I bet Rosie chose cotton candy. That's what I would choose. The doctor gives Rosie just the right amount of anesthetic so that she won't feel anything during her surgery. Anesthetic sleep is different than regular sleeping. Rosie won't have to worry about being able to fall asleep because the anesthetic will make her very tired. The doctor will tell her to breathe in the smell until she falls asleep. Then Rosie will fall asleep until her surgery is over. When Rosie wakes up, she is in the wake-up room. A different nurse is with her and tells Rosie that she will call her parents to let them know Rosie's awake. Rosie notices she has a tube stuck to her arm with tape. She says it feels weird, but it doesn't hurt. The nurse will be checking on her to make sure she is not hurting anywhere on her body. Rosie says her throat hurts, where the doctor did the surgery, so the nurse gives her some medicine through the tube in her arm. Soon, Rosie will get to see her parents again. Rosie's doctor said she can go home today. If she needed to stay in the hospital, Rosie would get to go to the children's unit. Since Rosie gets to go home today, she will wait in the hospital until the doctors and nurses tell her parents she can go home. Thanks for watching.